For some people living with depression, progress can feel slow. It can also feel like you're not progressing at all. Even after trying multiple medications or engaging consistently in therapy, there's still a sense of being stuck. That doesn't mean you're doing anything wrong. Sometimes the brain simply needs a different kind of support. One such option is ketamine therapy. In treatment-resistant depression, or when someone is at high risk of suicide, the brain's internal communication systems may be severely disrupted. Neural networks involved in mood, motivation, and emotional regulation can become underactive or disconnected. Traditional antidepressants take time to act, and in some cases, they may not be enough. Ketamine works differently. It targets glutamate pathways and helps restore synaptic connections in key regions of the brain. That is, it helps the brain reconnect by rebuilding the pathways that affect mood, energy, and emotions. This makes it one of the fastest acting interventions in psychiatry today. At Amaha Mental Health Hospital, ketamine is administered through a controlled intravenous infusion. Each session takes place under close medical supervision with anesthetic support, with continuous monitoring of the heart rate, blood pressure, and oxygen levels. The infusion typically takes about 40 minutes. You will remain awake throughout and may experience a sense of lightness, altered awareness, or mild dissociation, which are expected effects of the medicine. Ketamine is not a sedative. It is a dissociative anesthetic that has shown strong evidence in reducing the depressive symptoms, anhedonia, and suicidal thoughts, sometimes within hours of the first session. However, not everyone responds. It is an acute treatment, which means we do not expect long-term results. Ketamine is only for urgent care. That's why ketamine is always offered as a part of a structured treatment plan that includes therapy, psychiatric supervision, and ongoing review. In India, ketamine is classified as a Schedule X medication. Its use in psychiatry is considered off-label, which means it must follow strict legal and clinical protocols. Ketamine is delivered only if the client fulfills this strict inclusion and exclusion criteria. At Amaha, our care model reflects this seriousness. Every session is MHCA compliant. Informed consent is taken in advance. All storage, prescription, and documentation follow protocol. And because ketamine has the potential for misuse or dependency, all treatment is delivered under careful, medically supervised conditions. After your infusion, you may feel drowsy or disoriented. We monitor you throughout recovery and recommend that you avoid driving or returning to work immediately. The dissociative effects usually wear off after 1 to 2 hours. A typical course involves multiple sessions over 2 to 3 weeks, with clinical assessments guiding your treatment progression. Ketamine isn't a first line of treatment, but in cases of severe depression, suicidal thoughts, or treatment resistance, it can be a critical part of recovery. At Amaha Mental Health Hospital, we offer ketamine therapy within a comprehensive, protocol-led care pathway that prioritizes safety, structure, and lived experience.